So if I return back to this slide, and we talk about an individual going from chaotic to abstinence, and maybe the individual has been using for 25 years. I wonder if you can imagine what it would be like for a person to hear you're going to discontinue all of the drug use and alcohol use effective immediately, and you're never going to be able to do it again. What does that message feel like when it's the only coping mechanism an individual has known for however many years? A more realistic approach would be to go from excess to moderation to abstinence. What would it feel like if I said to you out loud here today, okay, Sam, you have drug use goals, and what you have outlined is you're going to go from drinking 1/5 of alcohol a day to only drinking on weekends. And you're saying that Monday through Friday, you're going to be able to make it through without any alcohol. And on Saturday and Sunday, you're going to have set amount of alcohol. Does that sound better than saying you're going to remove everything, all the drug use that you have in immediately for the rest of your life? I hope you agree that it does. Recovery is not linear. Recovery involves a lot of behavior changes. It starts with willingness. It starts with an understanding that my life is associated with the consequences that I'm living in. It starts with an idea that I don't have to live my life like this and there is a way out. And that involves willingness. And I might establish some drug use goals, and then I have to go through some behavior change. And then I've got to learn how to manage cravings on a daily basis. And then I've got to look at what are the stresses in my life that caused me to use. And then I've got to find some supports and learn some coping skills to replace the old patterns of behavior. And maybe I have to look at my past trauma. And so you can see it's a long, winding road. Some say that as long as it took you to go into the forest, it's going to take you that long to get out of the forest. We really want to understand here, folks, that recovery is not a start and finish line. There's twisting, winding roads. And how can you, as a community partner, embrace this idea? And can you imagine if you could empathize with this theory and support individuals through this winding road that is very difficult, that maybe we might have improved outcomes? Let's talk about some common causes for slip or return to use. These are the most common causes for someone to slip, have a reoccurrence, or return to use. Okay, folks? Withdrawal. One of the hardest things to do is make it through withdrawal without returning to use. You have 4 emotional and mental withdrawal symptoms: anxiety, depression, sleep, and cognition. Poor concentration, poor memory. It's really hard to think about anything when the only thing you can think about is the obsession and the craving that's consuming every ounce of your body. Anxiety and panic attacks, irritability. You've heard about people who quit smoking and how irritable they are. Well, why don't we adopt that concept or that theory for folks trying to stop drug use? Why don't we allow them to be irritable? Why don't we embrace that? Folks, for a lot of people, anxiety and panic attacks never surfaced until the drug use stops. And imagine what it's like if you have any experience yourself with anxiety or panic attacks, what it's like for an individual whose symptoms have been masked by their use for however many years. And now they've discontinued use and they're having these experiences and they don't know what to do with them. Depression, lack of sleep, folks. For those of you who have lack of sleep, you know what it's like. It's painful. It gets 10 times worse, 20 times worse when you're trying to discontinue drug use or alcohol use. Okay? People return to use as a result of withdrawal more often, most often because of withdrawal in the early stages. All of these symptoms cause unmanageable stress. The individual's coping mechanism prior to trying to discontinue use was drugs or alcohol. That's the only thing they know. We have to start embracing the concept of replacing old patterns of behavior with new patterns of behavior. And that's not an easy task. It can't happen overnight. Post-acute withdrawal symptoms can occur for up to 1 year after discontinuing use. It's described as a roller coaster of emotions and thoughts. Can look like and be the onset of depression. May come and go unexpectedly. Irritability and hostility, depression, mood swings, low energy, insomnia, and limited ability to focus or think clearly. Folks, people don't want these to be the side effects of discontinuing drug use. The reality is this is what they are. For heroin, it's extreme pain. It's extreme diarrhea. It's nausea. It's dehydration. It's a lot of things, folks. And in order for someone to really have a strong attempt, a strong opportunity to reach their drug use goals, one of the hardest things they have to do is make it through the withdrawals. Support is essential. All of these things for a person who hasn't felt any of this for whatever period of time in active use causes unmanageable stress. Individuals who have substance use disorder know how to handle stress in one way and only one way: returning to use. Stress looks differently for individuals. I can share a story with you about the many times that I slipped. And the most significant time was actually the last day of my use, was when I had seen my daughter for the first time in a year and a half. And I got to see her supervised for 1 hour. And immediately after she left, I went out and I went to the supermarket and I bought a little nip of wine. And I went out to behind a local restaurant and I drank it down. And I remember vividly, because at the time I had had about 2 months of sobriety. And I remember vividly the feeling of it going down and my brain actually changing and feeling very heavy. And I couldn't think anymore. And that was actually my last day of use. What's important here is that I hadn't experienced any joy in the 18 months that I was trying to achieve recovery. And after my daughter left, there was a subconscious level of stress that I was experiencing and that I didn't know about. And after she left, the only way I knew subconsciously how to navigate that stress was by drinking. So I automatically went on autopilot over to the grocery store by way of the railroad tracks and bought that wine. It was the last time. I went to my therapist the next day and I told him what happened. And he explained it to me that it's because I had never experienced that emotion in sobriety. And so when I talk about relearning patterns of behavior, it's navigating stress, navigating emotions for the first time without a drink or a drug. And how do you do that successfully? It's important to know that alcohol and tranquilizers produce the most dangerous physical withdrawal symptoms. So suddenly stopping alcohol or tranquilizers can lead to seizures, strokes, and heart attacks. The percentage of folks that this can happen to is low, but a medically supervised detox is really essential. So if somebody is talking about detoxing from alcohol or benzodiazepines, please refer them to a medical provider and let the medical provider determine if they can do it without medical supervision. Traumatic brain injuries and reuse. Substance use and addiction is a risk factor for developing a traumatic brain injury, and having traumatic brain injury increases the chances of developing a substance use problem. Again, it's that means of relief. For a person with a traumatic brain injury, they have their own struggles that happen daily, and individuals will find relief in some sort of substance. It doesn't mean that they have a moral issue. It means that they want the pain to end and they don't know how to have it end any other way. Similarly, substance use can increase the severity of traumatic brain injury. Research shows that continued substance use worsens traumatic brain injury outcomes in almost every way, including a greater chance of death, poorer brain functioning and recovery complications, as well as ongoing risks of additional head injuries. Some symptoms of traumatic brain injury include memory loss, mood swings, anger and rage, substance use disorder, depression, and anxiety. So just because somebody is having challenges with their recovery doesn't mean that they're not willing. It means that there could be some underlying symptoms, some other underlying conditions, such as a traumatic brain injury. We want to be able to explore this with the individual instead of casting stones or throwing stones at them and saying you're unwilling. Some with substance use disorder, especially those who have overdosed, have some level of brain injury. I'm going to stop this screen right now, and I'm going to move over to a movie on YouTube, again by Dr. Kevin McCauley, who we saw in Module 1. And this talks about return to use. And this, again, is in your additional materials in your course outline.
3 things that are known to cause relapse. Drugs, because they cause surges of dopamine. Drug cues, because they affect glutamate. And stress, which causes the release of the neurohormone corticotropin releasing factor, or CRF. The theory that explains the role of stress in addiction was developed by Dr. George Koob of the Scripps Research Institute in La Jolla, California, and Dr. Michel Lemole of the University of Bordeaux in France. Koob and Lemole refer to the brain's stress system as its anti-reward system because CRF acts to counter dopamine surges. If dopamine gets too high, for instance, during a binge drinking episode, the brain pushes back with CRF to restore balance. Ordinarily, the brain maintains this balance or homeostasis around a hedonic set point, much the way it maintains body temperature around the set point of 98.6 degrees Fahrenheit. During an infection, the brain resets its body temperature set point, and we get a fever. The brain's hedonic system works much the same way. With the repeated dopamine surges of drug use, the stress system is chronically overstimulated, and the brain can't maintain homeostasis. So what does the brain do? It gives up on homeostasis and reverts to what Koob and Lemole call allostasis. Allostasis is the process of regaining stability through change. And what changes? The brain's hedonic set point. In a desperate attempt to restore balance in the face of chronic drug use, the brain resets its pleasure threshold. Balance is restored, yes, but at a cost. Normal dopamine releases from normal pleasures no longer register, and the brain's pleasure system goes flat. Psychiatrists have a word for this state of the brain. They call it anhedonia. Under severe, prolonged stress, the brain becomes unable to derive normal pleasure from normally pleasurable things. Since normal pleasures no longer register, this person is essentially pleasure deaf. If you take them to Disneyland, everyone else has a good time, but they say, I don't get it. So what does register? Things that release so much dopamine that they reach the new pleasure set point. And what things do that? These dopamine surges cause the brain to lock onto the drug. From now on, anytime the brain is stressed, it goes straight to the thing that it knows is best at relieving that stress, and that's the drug. And this connection of the drug to survival is below the level of consciousness. Relapse is a process that is underway long before the addict is ever aware of it. I think this goes a long way to explaining why addicts have a tendency to relapse at precisely the most inopportune moment. The day before their court hearing, the day before the big job interview or the family reunion. It looks like the addict doesn't care about these things, but that's not what's happening. It's when they get stressed, they relapse. They don't know why, it just happens.
Hey there, this is Ginger. I hope you're learning a lot from this series. I'm asking for your help in supporting my tireless efforts. There's a few ways in which you can support me. Tell your friends about this video series, subscribe and like each video here on YouTube down below, make a donation